in protecting our eyes, um, there are certain circumstances that a lot of people may not be familiar with, or may not pay enough attention to. I'm referring to exposure to ultraviolet light. Ultraviolet light, if you absorb enough amount over a period of time, can cause the development of cataracts, as well as development of macular degeneration. To protect overexposure to ultraviolet light is especially important for young children, because number one, their eyes are very clear, and they tend to absorb proportionally a much larger amount of ultraviolet light than adults. And number two, that these young people, they have a much longer period from childhood to adulthood to middle age and old age to absorb ultraviolet light, and the effect of ultraviolet light is cumulative. Therefore, I would advise that if a person is going to go to be exposed to sunlight, that they should wear ultraviolet filter sunglasses, so that to filter as much ultraviolet light as possible to prevent the development of cataract and macular degeneration. Another aspect of protecting your eyes is concerns the use of computer and handheld devices like iPad or smartphones, because these days people are spending more and more time in front of a computer or in front of the mobile devices, and they need to know that their eyes need to have rest and need to be lubricated. Therefore, I would advise that when you are using these computer or handheld devices, that you should remember to blink, so that your cornea would have enough lubrication to keep your vision clear and to keep your eyes less fatigued. The other thing is that if you are going to be in front of the computer for anywhere from 45 minutes to an hour or more, then you should do all you can to get away from the computer, because in this way you will give your eyes a chance to rest, and also in addition your shoulder muscle and your eye muscle also have a chance to be relaxed. In that way you can feel much better, and your eyes will be able to see much better. If you absolutely cannot get away from the computer, then I would advise that you at least close your eyes for a few minutes to give it some rest. There are a few instances that you should seek the attention of your eye doctor immediately, because they represent more or less emergency situations. The first instance is that you've suddenly you find that you cannot see anything out of your eye, or you see a curtain blocking the vision of your eye. This can come without pain and without redness. So if it lasts more than half an hour and persists, then I would advise that you seek the attention of your eye doctor right away, because it can mean that you may have a retinal detachment that will require surgical correction. The second instance is that if suddenly you feel severe pain in your eye, and that is associated with blurry vision or headache, which lasts more than 15 minutes, again, then you should seek the attention of your eye doctor, because very often this can mean that you may have an attack of glaucoma that also require urgent treatment to protect the health of your eye. A third instance is that if all of a sudden you see double vision, that means you see two of everything. This can mean that the brain control of the eye movement movement of your eyeballs are affected, and it could mean that something is happening in the brain control of your eye. Sometimes it can mean stroke, or sometimes it can mean a blood vessel that is swelling or on the verge of rupture. In this instance, again, you should seek the attention of your doctor right away to prevent these emergencies. After middle age, one problem of the eye, one condition of the eye that can be serious, is what we call macular degeneration. Macula is a very small area inside your eyeball that's approximately 1.5 millimeter in diameter, and that very small area is responsible for detailed vision. Without that, you only see shadows. So if under examination the doctor finds that there is minimal changes in your macula, then he generally would advise that you should take more leafy green vegetables, because these vegetables, they contain antioxidants that will protect the macula to undergo degenerative changes. If there is a more moderate degree of macular changes, then the eye doctor would then recommend that you take a special kind of antioxidant vitamins. They usually consist of vitamin A, vitamin C, and vitamin E. These are antioxidant vitamins that would slow down any degenerative or oxidative changes. If there is substantial degree of macular degeneration, again, you don't need to excessively get worried or pessimistic, because for the past 5 to 10 years, a lot of different treatment modalities and medications are available to treat macular degeneration and prevent the development of severe visual loss. So it is important after the age of 45 to 50 that you should at least have a thorough eye examination to rule out any development of abnormalities in your eye that that are treatable. So that is generally a good advice. One of the most often disease of the eye is the development of cataract. I mentioned before that ultraviolet light over extensive exposure causes cataract. Therefore, in people over 55 to 60, the chance of developing cataract will increase. But these days, the treatment of cataract is a very refined and very safe and effective way. We use a minimally invasive technique. The incision only measure less than 2.5 millimeters, and we use a ultrasound probe to liquefy the abnormal cloudy lens and remove it, and then in its place we will put in a transparent artificial lens. This type of transparent artificial lens has been around for over 25 to 30 years, and they have been proven to be very safe. I have patients that I put in these artificial implant lens some 30 years ago, and they come back, they are still functioning very well. So it is a very effective and very safe procedure to treat cataract.